I don't get in trouble.
I need to apologize at the outset. My camera keeps going in and out, or my internet connection's terrible. So I'm here, but I'm going to be off camera most of the time.
No problem. I think if we do the, when we do the whiteboard, we'll see your cursor anyway, or we'll see your name floating around on there. So,
this is Bob Small. If I just may also interject. So I am off camera for today. I also have some things going on in the background, so I may be kind of in and out. So I just want to apologize for that.
okay. Great. Well, hi, everyone. I'm Liz Arjun. I'm a colleague of your CRIS facilitation team. I'm a colleague of Betsy and Nicola. I work in the Seattle office, and I'm really excited to be with all of you today. I facilitated some small groups when the CRIS first started getting going, and I'm happy to be back and hear about what you all are doing. And so anyway, I just want you all to know who I am, since I'm an unfamiliar face to some of you. For today, as Jamie described, and you got to see a little demo, we are going to spend some time with a whiteboard with really two goals. One is articulating what the guiding principles all that you all have agreed on, what it looks like in practice, and then identifying potential metrics for those, what you come up with in terms of what it looks like. So I'm going to put up the whiteboard and then give you a few tips on how to access it. And this is a new activity for me, so I apologize if I screw it up. But I'm going to do my best to make sure that that it works for you all. Let me see. Here I am. Okay. Collaborating. Okay. So, whoa. Okay. Can you all see it? Okay, it's really small, so let me make it a little bit bigger. Oh, good. I see Kashi already floating around on there. Let me make it a little bit bigger here. Oh, okay, and then I need to use the tool to move it down a little bit so that we're right here. Okay, so if you want to just take a few minutes, well, actually, let me orient you to the tools really quickly. So there's on the left-hand side, there's a select and grab tool over here. I don't know if you can see that on my screen, but there's a little hand which will help you to be able to move. It's on the left-hand side. And then there's another tool for a sticky note. So if you want to add your own, like I'm going to do this right here, I just take it and put it over here. If you run out of space, you can do that. So any questions about grabbing the sticky notes? I see people moving stuff around already. So, and if you want to delete something, just go to the undo button down on the right. Sorry, I heard somebody typing.
This is Kim. I'm still having trouble with the size. It's quite small on my screen. So
yeah,
I can't...
I'll make it bigger for you.
Oh, okay.
Second.
Thank
Yeah,
you.
yeah. If you get lost, there's also this little mini map down on the bottom right-hand side, which will kind of zoom you out, and you can figure out where you are, because this thing is like infinitely large and you can get lost sometimes. So, is that better, Kim, or should I make it even bigger? Why don't we just, I want you all to be able to, why don't we just do one guiding principle at a time? So let's read this one. Can you all see it?
I don't know if for other people it's not an issue.
No, I'm with you. It's so teeny. I can't.
Oh,
I couldn't put anything in the cell.
There's a zoom in on the bottom right as well.
Down on the bottom right-hand side. I'm sorry, for some reason, I think, I guess I didn't realize. Down on the right-hand side, you got it. Okay, yeah. Yep. So, and then the tools on the left-hand side allow you to grab the sticky note.
It also, if you click on the arrow that had it as select, it'll give you an opportunity to switch to a hand tool that says grab. And that's how I moved it, so it could center the thing I actually wanted to be looking at.
So on the left-hand side, the tool that has the little arrow, if you click on that, there's an option for a hand, and it's much easier to manipulate. So is everybody seeing the sticky notes, and you can zoom it? I didn't realize that you weren't seeing my screen. It's your own version. So if it's really tiny, is anybody still having a really tiny one? No. Okay. Larry, Robert.
Nope, I'm good.
Okay, you're good. Okay. So basically what we're gonna do is on the left-hand side, take a couple minutes to go to read each of the guiding principles. And then we'll spend some time first focusing on what does this mean in practice, and then we'll flip over to how does it get measured. So feel free to go ahead, and I'm gonna actually hide your all's cursors from the group. Linda, you can't.
I
Okay.
can't see it.
Oh, you
I-
can't see it. Okay.
I can't see anything, but I've got a little bitty laptop and I have bad vision, so that's the part of the problem.
Okay. Well,
I'm just gonna, I've got so many things going on. I'm gonna excuse myself. I'm sorry.
okay.
Yeah, thanks.
Oh, okay, Chloe, thank you. So now you all should be seeing you should be seeing my screen, so.
Sorry, you wanting us to just review this and talk through it, or do you want us to be
Yeah.
adding?
I think go ahead and start adding, and we can, if you want to, if you're done reflecting. I guess if folks are done reading, why don't we start talking through, or would you all rather just do this on your own and then talk? It's like folks are just going ahead and populating, which is fine.
Formatting on mine is getting all wonky. Okay, sorry.
Yeah, the sticky
Okay.
notes moved away from
Yeah.
there we go.
There it is.
Thank you
Okay.
to whoever fixed that.
I should have asked first, does somebody want to be the reporter for this group to the main room? Any volunteers?
I would maybe volunteer after we have a conversation and I know what
Okay,
I'm
sure,
reporting
sure,
about.
sure. So, yeah, I'll give you all a few more minutes to just sort of continue doing what you're doing, and then we'll talk through, and if we need to add things, we can. Is everybody able to do this? Are you feeling comfortable populating it?
No, I'm having a really hard time navigating.
Okay, so tell me where you are, Connie.
Well, I'm seeing this place where people are putting sticky notes, but I'm not seeing sticky notes that they're placing, where they're coming from.
Okay, I see your name on here, so just click on one of the sticky notes.
That's already in the grid.
Yes, yep, and
Okay.
hit like the T to enter text.
Okay.
Did that work?
Or I think you can double click on the sticky note and it'll let you start typing in it.
Typing the T.
Oh, I
Okay.
see. Okay. Okay.
So just click there or wherever, just pick one. Yep.
Okay.
I can probably go ahead and put something in for you too, Connie, if it's proving to
I'm-
be difficult.
No, that's okay. I'm still trying to kind of navigate what's going on. Just reading right now.
So basically just for each of the guiding principles, we want to have, what does this mean in practice? And then a correlating measurement post-it, sticky note,
Okay.
how that's being measured.
I'm just curious, when we're looking at this or thinking about our response, are we thinking of the entire system or just 988? So like, are we thinking of just the call centers or also the mobile response or the,
I think
go?
yeah, the whole continuum is that because we're talking about the 988 crisis response.
Okay.
So people
thank
in
you.
crisis in general, yeah.
Right.
Oops, where did my hand go? Okay. Here we are. So I see Connie, I see Kim, I see Kashi on here. I saw Larry over on the right-hand side making some comments.
I'm just watching it and it's bouncing around so quickly. that I just-
It moves a
I'll just
lot.
weigh in when time comes.
Okay, oh, well, why don't we go ahead and do that and I can start populating whatever
'cause-
you want to say.
Every time I try to type something, it moves on me.
Yeah, yeah.
Okay, all right, okay, then I'll just go ahead and do it for folks that are having challenges. That's why there's a facilitator. So for guiding principle number 1, people in crisis experience care that is responsive to age, culture, gender, sexual orientation, et cetera, et cetera. What does this look like in practice for you? I saw there's one, call takers are trained to resources for a wide range of ages. And then I see a measurement, I think this was you, Kashi, the number of training, one of the ways we'd measure that is the number of trainings for call takers on available resources to support various age groups in crisis. I see another one that you put in, Kashi, staff at crisis call centers are representative of the community served. And then the corresponding metric is demographic information on all call takers as compared to community. So why don't we go over here to what does this mean in practice? And if something that's coming to mind and you don't see it on the post-it, let me know and I'll start typing it in. So Larry, do you have something that like in practice?
No, I'm just I'm just looking at the questions and they seem to be 2 are of the same order and one seems slightly different. The 2 and 3 are kind of functional, how the system is set up. The first one there is more of, I guess, in some ways, an impact. On that first one, what we're talking about is essentially the triage function of 988, right?
Mm-hmm.
So when we
Right.
say experience care, it's experience care in that first step. Beyond that, any kind of referrals or anything that happen, that's not the purview of what we're talking about, right? So what we're talking about is what is that near-term experience of the caller? Is that?
No, I think it's the call and then also the initial response. Kashi?
Yeah, sorry, I shouldn't have put my Zoom hand up so fast because I think you said what I was going to say, which is I think there's a large conversation about that call centers and 988 was designed with the at least stated intention that a significant portion of the calls, texts, or chats would be resolved over the phone or over that interaction. So this is the care that this guiding principle is both about the care they would receive in interacting with 988 via call, text, or chat. And also, in my opinion, that could expand to the resource that 988 as the call taker refers them to. So if they're talking to a 16-year-old in Bellingham, ideally they would be receiving care that's responsive to how you would talk to a 16-year-old in crisis, but also you'd be referred to things that were actually in the greater Bellingham area and would take youth.
Great, that's really helpful. Yeah, got it.
That's right. Okay, so with that in mind, do we have other comments about what that looks like in practice? I see 3 on here about call takers, about calling in, and then some associated measurement. Are there other things that we would see in a system that is responsive to age, culture, gender?
Yes, so I just want to add something to. I'm technologically impaired, so I'm having a lot of trouble with this.
No
But
problem.
the second box there where it says call takers are trained to resources for a wide range of ages, I would add everything else that's in the guiding principle too. So not just ages, but culture, gender, sexual orientation, people with disabilities, etc. I think all of that belongs in that box,
Okay.
not just ages.
Tashi, I think that was your comment. Are you okay if we just expand that to say wide range of ages, culturally, et cetera, et cetera?
I agree with the principle of expanding it. I'd like to put it in different sticky notes because I worry that the measurement, I don't want the measurement to get muddied into how many trainings they have to go to in general. I do want a scope to how many trainings do you have to go to on a wide range of ages, including minors and seniors and transition age youth, right? And then call takers we could add another one for call takers are trained to resources for a variety of gender expression and sexual orientation, right? And then that would be LGBTQ plus training, how to talk about gender affirming care, how to use pronouns and various other sort of identities. And then I don't know what to do about developmental disability. That's a whole other, I can't tell if that would be different than or in addition to the wide range of ages. Maybe that's developmental ages, but yeah, I like the idea of expanding that one, but I would want them in separate things. So we were tracking them separately.
Yeah, I have no disagreement with that. I think that makes perfect sense.
I would say developmental disability does not go in the same as age.
Thank you.
Each one of them is different.
Okay. And Connie, this would be youth and adults with developmental disability, right? Not just youth.
Correct. Yeah.
Okay. Let's say people.
I think you also need to consider people who are neurodivergent.
Okay, and Liz, I'm adding that one.
Neurodivergent, okay.
I'm adding the ASD, IDD, and neurodivergent.
I don't know if this is necessarily a measurement, but I think there's a big difference between being trained in it and being able to practice it. I feel like call takers not only need to be trained, but they need to provide some sort of evidence that they understand it and can actually implement what they're learning.
Building on Connie's point, and I think Kashi put this in there. I mean, you've really got two types of measurement, right? One is the what we put in place, right, which is a lot of these things, number of trainings, type of whatever it may be. But then that client experience survey data is the counterpart to that will tell us if our measurements, if what we're, the questions we're asking are broadly right. So going back to, what Connie said. So I think that client experience survey data actually runs across everything, but it's almost a secondary. We may or may not have that much control over it, but it should be kind of like I say, the gut check against the others, because we may be asking the wrong questions and providing the wrong answers, right? And walk away saying we're successful. So you need both of those.
And I think to that point, probably each one of these could have a process measure and an outcome measure. Like, what are we doing? Like, how many trainings are we providing people? But also, does it result in good care for those communities? And I don't know how to, I'm very open to ideas, but I don't know how to capture the outcome measure for each of these, which is why I was leaning on a process measure of like the number of trainings we provide or the number of hours of trainings we mandate, which is, quite frankly, a highly flawed metric for what this looks
I mean,
like.
it's that formative summative evaluation, right? I mean, the
Right.
formative is something that, we can point to. I mean, just practically speaking, I think that you have to at least do spot checks here and there. It is, it'd be very challenging to have some kind of statistical relevance to get enough people to go across it. But even if it's just helping you squint your eyes and say, yeah, that looks right, I would think that whatever these indicators are need to have a summative user experience input.
Well, and also, I mean, it's sort of it's like the customer service piece of it. There's the process, there's the customer experience or client experience or patient experience, and then there's the outcome piece too. So it's multi-factored. And I'm wondering, I see somebody put spot check. I don't know if that's you, Chloe, but Kashi, you seem pretty nimble with this tool, so maybe you put it in.
I have figured it out in my crash course. I had to use a mural board recently, and this has similar vibes. So
Yeah.
I'm trying.
So I think basically, for the ones that we repeated, for, call takers need to be trained to different X, Y, and Z, we just would want to have a correlation over on the right-hand side, a measure for that particular population. So number of trainings, spot checking. Okay. See client experience data. Okay, great. You guys are really getting the hang of this. Create some type of feedback loop. Yeah. I wonder if we've got trainings, client experience survey data. I wonder if there's some way to track. I'm just thinking about someone calls in and they get referred over. Is there some way to track like successful referrals, or that's more of a process, I guess.
I mean, I think the other sort of like outcome measure in terms of a proxy measure for outcomes is that, like, if we were to track demographic information, which I'm, to be clear, not convinced. Anyway, I'll keep my commentary out of this for a second, but if we were to track demographic data and we want this to be a resource that is inclusive and accessible to people from a variety of racial and ethnic backgrounds, for example, we might want to see that reflected in the demographic data of the people using the system, right? That tells us we're doing a good job of making it inclusive and supportive to a wide range of people.
So basically looking to see, are the folks using the system, do they reflect the diversity of the overall population?
Right.
In the way that they're using it, right? So do people feel welcome? Like, do
right.
they, and do they know about it, but do they also feel like this is gonna address their needs?
Yeah. And I know there's some limitations on tracking demographic data, and I feel like those are with very good reason. So I don't feel great about having to track the demographic data of people who are calling because it's anonymous, but I do think it's an important way of thinking about if we are being accessible to the entire community that we are trying to serve.
Should we move down to the next guiding principles? Anything else we want to add up in this section?
Just a general, a general question. This seems really obvious and I may have missed it, but the whole point of this, right, is to get people to actually call and engage to be referred someplace. Have we set kind of expectations around usage in general?
Expectations on whom?
On anyone, like how frequent, what's the volume of use? And then, because I think a lot of what we're talking about is kind of quality of experience, but do we have any plan for this is what we'd like to get? I know that, for instance, early on among youth, there was a real question around, is this something you would use, or is this, they're tracking you and so on and so forth. So in some ways, before we even get to this, it's just broadly, do we want people to use it? Because we could have all these things, but if a handful of people are using it, it's all for naught. Well, I wouldn't say all for naught.
I just put a note, I just added, does the volume of calls match what we expect? Not knowing if we have that. I mean, I
Well
know
said.
that,
Very simple and well said. Yeah.
well, and because I do recall from way back when this work first launched and we were trying to figure out what's the need. There have been some, there have been calculations about how many caseworkers you need, there about to support the crisis work. So we should have a sense of how much we would expect the volume to be, but it's a good flag for sure. Anything else before we move down to the next guiding principle? I did it wrong, but I'll get over myself. Sorry. It's hard to not be next guiding principle. So I'm going to scroll us down. I'm not sure if everybody's still looking at mine, but the crisis response system is empowered by technology that is accessible by all. So what does this mean to you? What does that look like in real life? I see crisis response resources are accessible via phone, chat, or text. People in crisis can access support in their language. Great, and some measurements over here. Number of callers connected to resources via chat, text. Number of calls, text, chats answered by language. Okay, so other things that folks would like to put in, what does this guiding principle look like in real life? If the crisis system is using technology that is accessible to all, what does that look like?
So,
You go ahead.
so thanks. This is Kim. I mean, I think this does open for me questions about sort of access for folks who use communicative assistive devices, folks who are deaf or hard of hearing. Like, I assume because this is a state service that like those things have been considered, but like I don't know, and I didn't fill in a box there, but we want to make sure that folks who communicate differently are able to access. I mean, that's an ADA requirement, so I think probably Washington is paying attention to it, but
One of the ones I would love others' thoughts on is, I feel like what this means in practice to me is that you don't experience a difference in the type of care you receive, depending on how you interact with it, right? If you call, if you text, or if you chat, you should get the same sort of experiential component of resolution, either in that interaction or the same level of connection to resource. So I don't know how to measure that. That's what I would love help thinking about.
Would it be kind of looking at many of the things that we talked about in the box above around, doing spot checks across the different, and then doing like some customer client satisfaction? Is it really just making sure that we're looking at all of the process and outcome measures that we talked about above and slicing and dicing it for the modalities available?
I think it could be satisfaction or experience survey data. The other thing that I was trying to sort of bat around in my brain was the concept of like, I don't know if this is trackable, but the percent of calls that result in mobile response, and then the percent of texts and chats that result in mobile response, because that's something they can be compared to each other. It's comparing apples to apples. It's a percentage, not a number, right?
Yeah.
So maybe
Absolutely.
something like that. Okay.
Yeah. Larry, it's your hand up.
Yeah, I was just going to say, another way to measure this, and it may be effective, but it may not be, is number of how many calls are completed. So if in my experience, if I'm on a call and it's not responding to my communication needs, and I'm in crisis, I'm probably just going to drop. I'm not going to work through it. So that might be a simple indicator, is, and then you could look at it by different modality as well.
And that makes me think about wait times too. How long do you have to wait to talk to somebody over the phone
Exactly.
versus for a text or chat back?
Right. I mean, it's not a perfect measure, but it is a little bit, easier to gather. And at least, again, you can kind of squint your eyes and make some assessments.
Mhm.
So wait times are evaluated for each modality. Small. Satisfaction, experience, survey data, number, percentage of calls and chats referred to mobile crisis. Yep. There's another one down here about people in crisis can access support in their language. So number of calls, text chats answered by language.
And I'll probably update that right now to the number completed versus the number dropped.
Any other thoughts on what this looks like in real life? The crisis response system is empowered by technology, accessible to everyone.
In the spirit of the bed registry conversation, this is making me think, especially that post-it note about ability to see what resources are available in the system. Not only technology that's accessible for the caller, but technology that's accessible across the provider system.
Yeah.
Yeah, I put that one in. That's what I was thinking about.
Ah, same page. Okay.
Yeah.
No, I mean, we need to be able to, we need some type of centralized system that like all the different big players can see so that we have a good idea of what's available. So as referrals are being made, you can make thoughtful referrals about what's actually available in that moment. Because it's not helpful if you're continually making referrals that they're full or that's not in that community or whatever.
Are you thinking of something like the Care Everywhere in the Epic system?
Yeah.
I'm not sure what Care Everywhere in the Epic system is, so maybe.
So Epic is the electronic
Okay.
medical record system, and Care Everywhere allows organizations to see other organizations' notes, medical records. So Multicare can look at Providence, or Franciscan can look at Swedish, those kinds of
Yes,
things.
exactly, something like that. And then we have to, right, provide enough incentive so that people keep the information updated.
And I hope that then the outcome of, I mean, the process metrics there are really important, but my hope would be the outcome metric is probably decreased wait time, right? Like people are actually getting referred to the right element of the right resource or the right level of service. And so they aren't stuck
Yeah.
in this limbo of waiting for the wrong thing.
I'd hope decreased wait time, but also if you go back a little bit further, hopefully like, well, less utilization. They're able to get maybe moved to outpatient or maybe able to not need to utilize a crisis system as much. Or who knows, maybe it's great that they're utilizing a crisis system in this point and they're not going through the emergency room. And it's always trying to provide the care that's needed. With
Yeah,
hopefully not needing to escalate.
the right care at the right time,
Yep.
which is hard to measure, but the goal, it's the dream, right?
Always the dream. Yeah.
But I think you see it through potentially like it's decreased wait times, but it's also increased referrals. It's moving people
Right.
through that process much quicker. Because you are able to say, oh, there's a bed here, there's not a bed over here, or there's a team here. Yeah.
Or looking at, big picture, like over time of are we seeing more
A trend.
trends, utilization of the crisis system, but then hopefully less utilization of inpatient. Or interactions with law enforcement.
So I just put the trends over time that, you know, and it gave an example, decreased interactions with law enforcement, are referrals going up, are people connected, to services more?
And now I'm just talking instead of just typing, but somehow, I mean, I think what we're trying to do is make it just really a really easy system to use. I mean, that's not thoughtful or like a deep thought, but you do it what's easy.
I mean, I kind of go back to that one comment about, does the volume of calls match what we'd expect? Sort of like, if we make a system that's easy to use, then we're gonna see that, you know, that over time, the volume that is growing, but also reflective of what we'd expect it to be in the population. Any other thoughts on what this looks like or what we need to measure for empowered by technology, accessible to all?
I would love to think about the ease of referrals to systems that I would think to be sort of adjacent to behavioral health crisis, but not necessarily explicit to behavioral health crisis. I'm thinking largely about social determinants of health or community connections, or like, yeah, housing, food support, transportation, right? Did we get you an appointment, but you have no way to get there? I'm curious, and somebody saying care everywhere, or made me think about the closed loop referral systems for social determinants of health referrals. And I don't know that we actually need that exact thing here, but some sort of way of saying the barrier to you accessing the crisis service you need is something adjacent to our system, but we have an easy way of connecting you to that system so you don't have to get lost there looking for transportation, housing, food support, something like that.
So closed loop referrals with health related social needs is happening. So like a system that's really effectively supported, we're gonna be able to see that is effectively happening. And if it's just like a short-term crisis, I don't have housing or I don't have food, it's the same as if we're referring somebody to behavioral health. Like we need to be able to say, yes, we connected this person and okay.
Or even if that doesn't fall under the purview of 988, let's just take 211 as an example, right? Maybe the connection is just that they got to 211s because somebody was able to identify that what would make the crisis system accessible is addressing their social determinants of health. And that may not need to be 988 making the closed loop referral, right? But it might be connecting them to 211 so they get to do that.
So it's not exactly aligned, but like in terms of the way that these are laid out, but basically that for that closed loop referral data from 211 or other systems that connect people to health related social needs.
I suspect we'd get pushback on that. What I would put there is the number of referrals to 211 or other systems. I'm happy to be corrected if others feel differently, but I suspect that 211 is not going to hand over their data to us.
Right. Anything else that we want to add in this one? For this guiding principle? Or we want to go down to the last one? Okay. last guiding principle, the crisis response system is financed sustainably and equitably. So I see three sticky notes in here. System can hire and retain staff to meet demands and provide high quality service. The measurement over here, staffing levels are sufficient and turnover is minimal. Another comment, crisis response system offers competitive salaries in line with other first responders, and then the measurement would be salary comparison. Then I see the last posted on here, crisis system financed in such a manner that it can field calls, but also provides sufficient response to callers.
One thing go ahead, I'm sorry.
No,
I was just going to say, so I would also, in terms of sustainability, maybe think about, to the extent we can, how this is funded going forward, so that it's not a one-off, but, you know, we're talking about a 5-10 year horizon.
so long-term funding.
Yep.
System has long-term, dependable, forecasted long-term funding. Larry, any thoughts on how we measure that?
You know, yeah, I mean, it depends on the revenue streams, right? And what you think. I mean, is there, where is it coming from, and how long can you do that? I mean, no legislature can hold future legislatures to what they said necessarily, but one would hope that at least in a biennium, you would pass A, B, and C, and maybe, you know, that's it. Or if it is the, you know, tax funding, a percentage off the top, whatever the funding model is that it just simply takes in consideration as long as a horizon as fast as possible.
Right, so diverse set of funding streams.
Yeah, I mean, a diverse and like I say, you know, it's how long will people fund them? I mean, each one's going to be slightly different, but it may also be something to consider, and this is always tough, but you know, annual increases, right? Usually when you build a budget, you might put 3% in every year just to accommodate for things. And it's that level of detail, is that it's not just a baseline in 2025 and then in 2030, it's the same thing. That's not going to work either. So it grows both with demand and with the cost of living.
I put diverse and growing funding streams. That's how we measure that. Okay, I see another comment, the needs and experiences of callers contribute to continuous process improvement by the crisis system. And then we would measure this by data on gaps in available care and or data on client experience is used to inform improvement.
And I'm happy to be told that that one shouldn't go in this space, but I'm thinking about if this is about sustainably and equitably financing the crisis system, emphasis on system. If we were to find out that, I'm just going to make this up, you know, there are a ton of callers to 988 who don't get access to a mobile response team because we don't have a mobile response team in their area, that should tell us that we should be resourcing a mobile response team in that area, right? So not just about funding the call centers, but about, you know, really nimbly growing as a system to expand in the ways that people are asking us to.
Because we have to expand all of it.
Yeah,
And
I
there
totally
have to be
agree.
resources throughout it. So like, yeah. And
I mean,
as we expand 988 or, you know, make it easier, more known for people to call, the need for the other services are going to grow.
I think that's a really important point. I mean, in a lot of ways, 988 is growing demand, right? It's giving people the access to say we need help.
Right.
But without that supply on the other side, you're actually creating more problems than you're solving potentially. So I completely agree with Kashi that should go in there.
Yeah, and I mean, if you you don't have the data that shows the need, you can't ask for more money. So it's kind of a circle.
Well, we can ask for it. It's just harder to get.
It's harder to get, but the data does show the need. Okay, what about the, anything else that folks want to add to this one? Oh, sorry. Kashi, somebody else told me that they couldn't hear me.
You just sound far away. Like I almost feel like your headphones aren't working. Like the mic,
Let's take off my
I feel like
headphones.
it's a different microphone in some way. Maybe
Can you hear me now?
it didn't change. You just sound far away. Maybe others don't have the same challenge.
No, I'm same thing.
Okay.
So when I look at the post-it notes we've put under the crisis response system is sustainable and equitable. Oh, I can't move it now. Oh, there it goes. I mean, you're looking one at like this first box to me kind of talks about like workforce retention. How do you actually create a workforce that people are going that are highly qualified and will stay in the field? Those are the first two really. And then the third one there is really about how do we finance the system? With the crisis system is financed in such a manner that could field calls will also provide. So yes, so making sure the entire system is supported. And then I think that last one is even bigger picture. System has dependable forecasted long-term funding, like Medicaid and tax revenue is the primary funding sources at the moment.
So we put
Which
down,
yeah,
well, we
which
put diverse and growing funding streams.
right. And the importance of the diverse part is not everyone has access to Medicaid. So how do you make sure that you're, for the individuals who, yeah, that everyone's able to be served? Because our crisis system is available to all.
Yes. I think we start to measure things like our provider, our insurance companies. What percentage of the claims for crisis providers are paid by private insurance? Does that make sense? Can you guys hear me? I know I'm having some issues with sound apparently.
We can hear you. You're just far away,
Far
but
away?
we can hear you.
Sorry. I tried to unplug, but it wasn't working. So
That was my only tech problem solving suggestion is to unplug it and plug it back. And so I'm
Can you
I'm
hear
out
me
of
now?
useful ideas. It sounds
I
the
can't hear you
same.
guys now. That's the problem. So, oh, hold on. Okay, I think I can hear you now.
Can you hear
Can
us?
you talk again?
Yeah. Can you hear us now?
I'm gonna put my comments in the chat.
Okay, we can hear you. Can you hear us?
I can hear you now.
Okay, all right. You still sound far away, but we can hear you, so I think it's totally fine.
Okay. I'm gonna put a comment over here about for the diverse and growing funding streams one that we're measuring who is paying, which sources of coverage are paying for crisis services. Does that make sense to you all?
Yeah.
Because right now it is heavily Medicaid, and we know there's been some changes to law to require private insurers to contract with crisis providers. So we can look at that and see what's happening.
Yeah, so I'm going to make a couple comments here representing the commercial insurers. The first piece of this that's being skipped is whether the crisis responders organizations actually find out what insurance folks have and actually submit bills. I mean, I'm just speak for Premier. We've been covering crisis response services for ages, and the problem is we don't get billed. And we get complaints about not paying when in fact we haven't been billed. So if we're not billed, we can't get paid. It's as simple as that.
Yeah, it goes back to that ease of use. How easy is it when you interact with somebody in a crisis? That's a crisis situation to gather the information that they would need potentially to be able to do the level of billing that you're describing. Yeah, absolutely. It's
Yeah.
tricky
No,
stuff.
that's absolutely true. In the middle of a crisis situation, crisis responders are generally not going to try and get that information, which means the agency has to go back to the individuals later on to try and gather that information.
Yeah, it's actually easier further downstream. So like it's easier with mobile crisis responders if they're doing kind of the follow-up care, or easier for when a person is going to a crisis stabilization facility, like the somewhere to go, because you have enough time to actually gather that type
Right.
of graphic information.
Yeah,
But in that
absolutely.
initial, right, but in that initial response of someone on the call, that initial call, it's tricky. Which I think goes down to that diverse and growing funding streams. You need lots of different funding sources.
So I just put this comment in. Can you all hear me? Is that better?
Yeah.
Okay.
Yeah, that's much better.
All right. Some setting must have gotten changed. I'm so sorry, everyone. So your comment is it's both the crisis providers need to know how to bill private insurance, and then also then further downstream looking at how many of the claims are paid by private insurers once we've made sure that the providers actually know how to submit a bill or a claim.
Yeah, and I think, the other point that was being made is that providers have to be able to have a way to get that information, since it's not practical for them to get that in the middle of a crisis intervention.
Right. Okay, that makes sense. Yep.
And I think that's such an interesting element of that, because now that I'm thinking about insurance coverage, that has a huge impact on the resource landscape. And so being referred to resources that you can actually access is heavily dependent on understanding your insurance coverage.
Yeah, that is so true.
Hmm.
I am trying to go in and enter this, and I'm having an issue, but I will get it. Oh, Kashi's doing that
What
now.
time
You
are
want
we
me to
supposed
add
to
it?
go back to the other room?
I think we're gonna go back soon.
Right? Did we ever decide who our spokesperson is going to be?
No, I think Kashi said we'll wait till we get into this. So
I
does
didn't
somebody want to volunteer?
I did not want to volunteer too early. That's what I didn't want to do. Does someone feel strongly that they want to?
I feel strongly that I don't want to.
Oh, it was an opt-out, not an opt-in. I can, if we can agree on what we want me to share out. Liz, it was more like a thematic report out rather than a super
Yes.
detailed.
Yeah, it's very thematic.
Okay. Okay.
Claims to private carriers. And
I'd say some of the themes for the top one
Mm-hmm.
was very much about actually asking individuals about their experience and creating
Yeah.
some type of feedback loop.
Mm-hmm. Okay. Great. I'm taking notes. Should have been typing this because I think someone's going to ask me to send them to them. Okay.
and what about the second group?
Are you asking about the second guiding principle? Sort of what's the theme
Yes.
here? Yeah, I'm just trying to think of how we would summarize that. Maybe the diversity of those who are trying to access the services is really centered, and
And I think that conversation around not only technology accessible to the caller, but technology, the accessibility of technology within the system to make the experience easier for the caller.
Yeah, yeah,
good.
yeah, that's good.
Let's hope it sounds like good when I say it in the big room. Stay tuned.
So I think part of the guiding principle in the last one about the system is financed sustainably and equitably has to do with the definitely retaining a high quality workforce, but also the entire system being financed well enough that the services are also high quality.
That you can pay competitive salaries and retain a strong workforce to provide
Right.
quality care.
Yep.
Okay, breakout rooms are closing in 2 minutes.
And then part of what we're talking about, I think a lot with the measurement, and I don't know if it's the measurement, but understanding that like the funding streams have to be diverse and sustainable and ongoing.
Great.
Okay.
You feel okay, Kashi?
So much better than 3 minutes ago. Yes. Thank you for
Okay.
walking through the
Well, thanks
themes.
for flagging. I think what's happened is that the broadcast telling us when we're closing is showing up in the top and it's all black. So have you guys seen any of these notices coming through saying you have 10 more minutes?
I got a little notice. Yeah.
You did?
Yeah.
I only just saw the last one, but it was black and the background on my screen is black. So I probably didn't see it. It needs to be like red or something. So, okay, any final comments for folks in the room that you want to make sure Kashi reports out?
You can also chime in the big room.
And just thank you for volunteering.
Yes. Thank you, Kashi. And thank you, Liz, for helping us learn how to use Zoom.
Well, I'm sorry that you had to do it with my volume not working. I'm so sorry about that.
Oh, no big deal. We could still hear you.
We could still hear you. You just sounded far away, and that's okay. Thank you for letting me not volunteer until I felt better about what I was supposed to report on.
Yeah, no, you guys did a great job.
Okay. I have an option here to leave the room. I assume that's going to take me back to the regular
Yep.
thing. Okay. I'll see you all
Head
there.
on.
Okay.
Okay, bye-bye. See you in the big room.